I was at campus at the library at WSU, and I was reading the Chewelah Independent looking for jobs because I was about to graduate. And New Health had an opening for a secretary. So that's how I started with New Health. To look back and think where I've come in this and New Health's come in this journey, when I started as secretary of New Health, we didn't even have fax machines. To think of where we've come today in regards to clinical records, all electronic, and to look back, sometimes I think it was easier when it was all soap notes. In 1977, there were federal grant dollars available for rural health clinic startups and home health services. So members of the Southern Stevens County Healthcare Association and the Mount Carmel Hospital Board got together and created a board to apply for these grant funds. And lo and behold, we were awarded the grant, so here we are, almost 44 years later. The goal of the grant was to address issues of accessibility of primary care services, quality of care, coordination of care, and specific health services that were lacking in this Tri-County area of Northeast Washington, specifically Ferry, Stevens, and Pend Oreille counties. We started Home Health Services in June of 1978. Home Health had a run of 31 years. It was a backbone to our organization. We sold the Home Health Agency in 2009. When we sold the organization, we were up to 1,800 visits a month. And under Home Health, we had nursing services, physical therapy, speech therapy, occupational therapy, home health aides, and social workers. We also did in collaboration with Hospice of Spokane. We did that from 1997 through 2013. It was another great collaboration effort to provide hospice care to patients that were terminal. We had the home health staff, and so they were also our hospice staff. It was amazing. I look back on the journey of this organization and the board and what they did and why they did it. It's amazing to me, their foresight. Once we were awarded the grant, they had the task of where they were going to put clinics and that sort of thing. So when I came in 1980, there were already 5 clinics open, located in Northport, which was our very first clinic that we opened in April of 1978. We had a clinic in Orient, which was called the Kettle River Community Health Center, clinic in Springdale, and clinics in Curlew and Keller. New Health has grown tremendously over the years. We used to sit in our office and wait for the mail to come in to have something to do, but that doesn't happen anymore. Today, New Health has 7 medical clinics. They are located in Northport, Colville, Chewelah, Loon Lake, Springdale, and 9 Mile Falls, which is our Lake Spokane Community Health Center. And we have a clinic in Ione, which is the Selkirk Community Health Center. We have 3 dental sites. They are located in Colville, Springdale, and 9 Mile Falls. Our 3 pharmacies are located in Colville, Chewelah, and Lake Spokane. And our behavioral health services are in Colville. I think it makes our patients in our isolated areas feel very good that we are caring for them. The ability for them not to have to drive too far for services. That's the whole goal of New Health. We have a mobile clinic, and so that is exciting for me to provide services in even more remote locations than we have before. Our motivation, I believe, is just helping our people in our communities, serving our communities, providing great care, quality care, helping them get referrals to outside specialists that they would not maybe have any resources to go to gain services. It's been wonderful to see New Health provide integrated care in these communities for so many years, and to adhere to our 4 core values, which are patient-centered care, quality of care, ethical relationships, and respect for all. I think our mission statement is so important for new hires, our providers, our staff, to look at and really analyze what it says. We want open access to all and integrated care, medical, dental, pharmacy, behavioral health. It's so important for all of us to realize the importance of these services to our patients in our communities.